Hi and greetings. Today we are going to present about human body muscle.
So on page 1, as you guys can see, this is the muscle structure where all the muscles are specialized for contraction. When the cell contract, they shorten and pull a bone to produce movement. Each skeletal muscle is made of thousands of individual muscle cells, which also may be called muscle fiber. And on page 2, it shows the actions of muscle where most are grouped in pairs of antagonistic function. On page 3, it shows an overall view of the major superficial skeletal muscle that will be considered in more detail as we progress throughout the page. So, muscular system consists of axial muscle and appendicular muscle. First, we will explore on the axial muscle where it is divided into the muscle of head and neck that consists of face expression, mastication, tongue, pharynx, muscle of back, muscle of thoracic and abdominal region, and pelvic region. So on page 5 and 6 shows the muscle of facial expression from anterior and lateral view. The muscle of facial expression originate from the surface of skull and insert into the superficial fascia, or also known as epicranial aponeurosis. These muscles are connected directly to the skin instead of bone, so when it is contract, it will show and produce the face expression. At page 7 and 8 shows the muscle of mastication in lateral and posterior view. In anatomical terminology, mastication is known as chewing action. The function of muscles of mastication is to move the mandible at temporomandibular joint. Next, we move to page 9, which is the muscle of tongue. Tongue is important for tasting food, but it is also necessary for mastication, glutation of swallowing, and speech. We have 4 extrinsic muscles, which the name ending with glosses that mean tongue in Greek word. There are palatoglossus, styloglossus, hyoglossus, and genioglossus. The extrinsic muscle move the whole tongue in different direction, while the intrinsic muscle allow the tongue to change its shape. Next, page 10 shows the muscle of neck and pharynx. The muscle of pharynx initiate the swallowing process, while the muscle of neck control the position of larynx, where larynx is the voice box or organ that involved in breathing, produce sounds, and also protect the trachea. Page 11 shows the superficial neck muscle from posterior view. On page 12, it shows the back muscle from posterior view. On the left side, it shows the deep layer, while on the right side, it shows the superficial layer of erectus spinae that act as extensor of the vertebral column. Page 13 and 14 shows the anatomical structure of muscle in the thoracic and abdominal region. The bigger muscle in abdominal region is rectus abdominis or sit-up muscle. It serves as flexor to the vertebral column. Rectus abdominis originates at the pubic crest and symphysis, and it extends its length to the body trunk. Rectus abdominis segmented by collagen band called tendinous inscription. The tendinous inscription is transverse band of collagen fiber that cause the bulging and large muscle fiber that is known as six-pack. And in the thoracic region, we have internal and external intercostal in between rib that function to help the rib movement during the breathing. Page 15 shows the inferior view of the pelvic muscle for both female and male. Pelvic floor or pelvic diaphragm is actually a muscular sheet that forms inferior portion of the pelvic cavity and spanning anteriorly to posteriorly from pubic to the coccyx. The function is to support the organ of pelvic cavity such as urinary bladder, uterus, and etc. Basically, there is no difference in the deep musculature between female and male, only the genital organ that are differ. Next, we move forward to the second muscular system, which is appendicular muscle. For the overview of appendicular muscle can be seen in page 16. Both on page 17 and 18 shows the muscle of the pectoral girdle from the anterior, posterior, and lateral view. The muscle of pectoral girdle is important to stabilize the pectoral girdle and make it a steady base so that the arm can move efficiently. On the posterior view, it shows the muscle that elevate the scapula. Next, we move to the muscle that move the humerus arm. From the posterior view, the posterior part generally originate from the superior surface of scapula and the clavicle. For example, deltoid. Deltoid as a whole, it acts as an abduction of the shoulder, while anterior deltoid function is to allow flexion and medial rotation, and the posterior deltoid is to allow extension and lateral rotation of the shoulder. Next, we move to the muscle that can move the forearm and hand. It is originally originated from the upper arm and insert into forearm, and it is involved in 4 main types of action, which are flexion, extension, pronation, and supination at elbow joint. On page 21, we can see a group of muscle of flexor and pronators, while in page 22, we can see extensor group and supinator group. Next, we move to the muscle that can move our finger. The muscle that can move our finger can be divided into extrinsic and intrinsic muscle of hand. It is called extrinsic because it is originated in the forearm outside the hand, while the intrinsic muscle originated within the palm. Extrinsic muscle provides strength and gross motor movement for the wrist, hand, and finger, which allow the flexion and extension, while intrinsic muscle function is for fine motor movement such as typing, writing, or buttoning the shirt. On page 23, from anterior view, we can see the flexor muscle group that serve as flexion, while on page 24, from posterior view, we can see the extensor group that serve as extension. As mentioned before on the function of intrinsic muscle, on page 25, the intrinsic muscle can be divided into lateral palm or ternal muscle that consists of adductor pollicis, while the intrinsic muscle that located in the medial palm is called as hypoternal muscle, which consists of abductor digiti minimi, flexor digiti minimi brevis, and opponens digiti minimi, while on page 26, it shows the posterior view of the intrinsic muscle of hand. Next, we move to the muscle of pelvis and lower limb, which is the muscle that can move the femur and thigh. These muscles are important because the body center of gravity is on the area of pelvis. If the center of gravity is weak, maybe due to the muscle weakness or muscle imbalance, standing up straight might be difficult for certain individual. On page 27, we can see the gluteal group that functions are to abduct and extend the hip joint, while on page 28, we can see the iliopsoas group that serves to allow flexion in the hip joint. On page 29, we can see the muscle that move the leg can be divided into flexor and extensor. The extensor group are located along the anterior and lateral surface of the leg, while the flexor group located along the posterior and medial surface of the leg. Next, page 30 shows the muscle that move foot and toes. The muscle that are located at the anterior part of the lower leg, such as tibialis anterior, generally involved in the ankle dorsiflexion, while the muscle at the posterior compartment, such as tibialis posterior, generally involved in the ankle plantar flexion. Next, the intrinsic muscle of the foot on page 31 originated and inserted within it. The function of the intrinsic muscle of the foot is to provide support for the foot and the arch and contribute to the movement of the toes. Page 32 shows the interior muscle of foot from plantar view.
So let's take a look at the functions of our muscles. So we basically know that the function of our muscle is producing movement, maintaining the posture and position, giving support to our soft tissue, guard body entrances and exits, maintaining our body temperature, and lastly store nutrients. Here we can see the levels of functional organization in skeletal muscle, which start with the skeletal muscle organ, move on to the muscle fascicle, which is the bundle fibers, and then muscle fiber, which is cells, and move on to the lastly the sarcomere. Here is the sliding filament theory during muscle contraction, which the upper picture is a situation when the sarcomere in relaxed situation, and the other picture is when contraction occurs, we can see that there is a difference between when our sarcomere is in relax and contraction occur. For the shortening of muscle fiber, here we can see the difference between during a contraction for when the both ends are free while the other end is in a fixed position. There is three things in skeletal muscle activities. There is neuromuscular junction, excitation, contraction coupling, and contraction cycle and muscle tension. Here is what happened during initiation of muscle contraction. First, ACH is being released, action potential reaches the T-tubule, then sarcoplasmic reticulum releases calcium ion, active sites exposed and cross-bridge form, contraction cycle begins. For further explanation, you can prefer the diagram that is included in the slide. How our muscle contraction ends is not pretty different compared to the initiation. It's just that the ACH is broken down, sarcoplasmic reticulum reabsorb the calcium 2+ that released before, active sites being covered and close bridge formation ends, contraction ends, and the muscle relaxation occurs. Finish for skeletal muscle. Moving on to the cardiac muscle. So in page 43 we can see the structure of our cardiac muscle, and while its major function is automatic contraction, which is working like a pacemaker. Nervous system can alter the pace set by the pacemaker, can produce titanic contraction, and lastly contractions last about 10 times as long as skeletal muscle fibers. The last one is our smooth muscles. So the main function of our smooth muscle is coordinate movement of substances and the roles in integumentary system, cardiovascular system, respiratory system, digestive system, urinary system, reproductive system. In page 46 you can see the structural characteristic of smooth muscle. So as you can see, there is 4 functional characteristics for our smooth muscle. The first one is excitation, contraction, coupling, length, tension relationships. The third one is control of contractions, and lastly, smooth muscle tone. In the last page of our function of our muscles, you can simply see the difference between skeletal muscle, cardiac, and smooth muscles. So I hope that this will help you to differentiate between the 3 muscles.
Now we proceed on the muscle disease. We have few examples of muscle disease which are myositis, neuromuscular disorders, muscular dystrophy, soft tissue sarcoma, sprain and strains, tendinitis, and muscle cramps. Here is the first example of muscle disease, which is myositis. Actually, myositis have 2 specific kinds, which are polymyositis and dermatomyositis. The symptoms of myositis may include fatigue after walking or standing. Actually, myositis have no cure for this disease, but you can treat the symptoms by medications, physical therapy, exercise, heat therapy, assistive device, and rest. Next, we have neuromuscular disorder. Neuromuscular disorders affect your neuromuscular system, may also have symptoms such as spasm, twitching, and pain. Many neuromuscular diseases have no cure, but treatments may improve symptoms, increase mobility, and lengthen life. Neuromuscular disorder can cause problems with your muscles, the nerve that control your muscles, and communication between your muscles and nerve. Other than that, we have muscular dystrophy, which can call MD. MD is a group of more than 30 inherited diseases. They all cause muscle weakness and muscle loss. Some form of MD appear in infancy or childhood, other may not appear until middle age or later. And there is no cure for muscular dystrophy, MD. The next example is soft tissue sarcoma. This is actually cancers. This cancer causes a lump or swelling in the soft tissue. Sometimes this spread and can press on nerve and organs, causing problems such as pain or trouble breathing. Have a higher risk of the patient has been exposed to certain chemicals that have radiation therapy, or have certain genetic disease. Treatments for this cancer include surgery to remove the tumor, radiation therapy, chemotherapy, or a combination. Sprains and strains are actually included in the muscle disease. Sprains is an overextending of tearing of ligament. The ankle is the most common location for a sprain, while strains is an overextending or tearing of muscle of tendons. The lower back and the hamstring muscle in the back of our thighs are where strains commonly occurs. Other than that, we have tendinitis, or also we can call tendonitis. Tendinitis is the severe swelling of a tendon, and tendinitis usually happens after repeated injury to an area such as the wrist and ankle. Tendinitis also can cause pain and soreness around a joint. The first step in treatment is to reduce pain and swelling. Rest, wrapping, or elevating the affected area and medicines can help. Ice is helpful for recent severe injuries. Other treatments include ultrasound, physical therapy, steroid injection, and surgery. The last example is muscle cramps. Muscle cramps are sudden, involuntary contractions or spasm in one or more of your muscles. They are very common and often occur after exercise. Some people get muscle cramps, especially leg cramps at night. Happen mostly in the thigh, feet, hands, arms, abdomen, area along your rib cage.
Diagnostic instruments for soft tissue sarcoma. There are many instruments that can be used in order to diagnose soft tissue sarcoma, namely biopsy, CT scan, MRI, and PET scan. Let's look into biopsy. A biopsy is a removal of a small amount of tissue for examination under a microscope. Other tests can suggest that cancer is present, but only a biopsy can make a reliable diagnosis. There are different types of biopsies, such as incisional biopsy, core biopsy, and excisional biopsy. In incisional biopsy, a surgeon cuts into the tumor and removes a sample of tissue, and then that tissue is being sent to the laboratory for further diagnosis. Core biopsy. Core biopsy or a needle biopsy. In this procedure, a doctor removes a small sample of tissue from the tumor with a needle-like instrument. This may be performed with the help of ultrasound, CT scan, or MRI to precisely guide the needle into the tumor. Lastly is the excisional biopsy. In an excisional biopsy, the surgeon removes the entire tumor. Excisional biopsy are generally not recommended for sarcomas because second surgeries are often needed to completely remove the tumor. Next, let's look into CT scan. CT scan or computer tomography is a procedure that makes a series of detailed pictures of areas inside the body, such as the lung and abdomen, taken from different angles. The pictures are made by a computer linked to an X-ray machine. A dye may be injected into a vein or swallowed to help the organs or tissues show up more clearly. Other than that, let's talk about MRI. MRI or a magnetic resonance imaging is a procedure that uses a magnet, radio waves, and a computer to make a series of detailed pictures of areas inside the body. This procedure is also called nuclear magnetic resonance imaging, which is NMRI. Other than that, PET scan. PET scan or a positive emission tomography scan is a procedure to find malignant tumor cells in the body. A small amount of radioactive glucose, sugar, is injected into a vein. A PET scanner rotates around the body and makes a picture of where glucose is being used in the body. Malignant tumor cells show up brighter in the picture because they are more active and take up more glucose than normal cells do.
So that's all, and thank you.